much trouble to do something if I don't have a lot of people that are in pain. Like I've got to practice, things are going, I need to know, somebody say, this will be the benefit for doing this. All right?
I'll start off, because I've got to go early. But
Sure.
remember the slide I showed with the bananas and the monkey? And if you think mechanical, you see mechanical. If you don't, and this is because I've gone through this, if you don't start asking the questions, you don't see it. Bob Jenkinson's famous quote was, the less you know, the more normal your patient appears. And all of a sudden, when you start asking questions, and start looking at airway, and start looking at forward head posture, and one shoulder higher than the other, and one eye higher than the other, all of a sudden, you start to see things that you never saw before, and then you ask those patients the specific, the myomonitor, the myotronic signs and symptoms form. You start looking at arch form. You start looking at bilateral bicuspid drop-off, and all of a sudden, you realize maybe it's been malpractice. You haven't diagnosed properly. So that's just my own perspective.
All right, so I'm accused of malpractice.
You are.
Number one. That's not the first time that's been said. That's the problem.
I didn't mean that strongly. I didn't mean that.
No, that's a good answer. You want to?
Well,
we're having a drink.
The only thing that we can, the only thing I can add is just is besides the fact I totally agree with everything that Tim says, is that we all have a whole bunch more possibilities of work and production out of our offices that are just sitting there that we didn't realize it was just sitting there. So we can sit and look and go like, well, okay, yeah, you got a cavity, you got a filling. Gee whiz, you got this bicuspid drop, you got high neural palate, you got, and as you take the training, you begin to have more and more options of treatment available to you. So it becomes more and more profitable. You end up having to do less and less patients, and you're doing more with each patient. So my day becomes quieter, my day becomes easier, my day becomes more fun. I'm charging more for the patient, I'm getting more money out of that one patient, but I'm not running around like a chicken with his head cut off.